Good morning, everybody. I show that it's 10 o'clock, and I think we'll probably go ahead and get started. I know we'll have some folks joining us as time goes on. I want to welcome you to the Kansas Business Group on Mental Health in the Workplace webinar today. I'm Shelley Duncan, Executive Director of the Kansas Business Group on Health. And we're excited today to have with us Michael Brewer. Michael has actually presented for us before, and I know some of you have probably seen him, but we had some of our members really wanting to have some more information relative to mental health in the workplace. As you know, mental health has been an increasing need, I think, for a number of years, but particularly within the last year, and now we're seeing an increase in the need for mental health. And that certainly is impacting not only adults, but it's also impacting children. So I think you're going to find today very interesting. I will ask all of you to please mute yourself and would encourage you to ask your questions in the chat box. You can send those directly to me or to everyone, I don't care, but we'll be taking some breaks during Michael's presentation, not regular long breaks, just kind of some pauses to answer questions. So please feel free to put those in as they come up, and we encourage and welcome questions from you. For those of you that aren't aware about or are new to the Kansas Business Group on Health, we are a nonprofit organization that is an affiliate of the Medical Society of Sedgwick County. We're a membership organization that works with local employers to help them improve the value of their healthcare benefits through quality improvement and cost reduction. I'll talk a little bit more about the Business Group on Health at the end of the presentation, but for now, I am going to go ahead and introduce Michael. Michael is a duly licensed, he is duly licensed as a licensed clinical marriage and family therapist and a licensed clinical addiction counselor. He has over 18 years experience in the mental health and addictions treatment field. He's a member of the clinical adjunct faculty of the Master of Science in Family Therapy program at Friends University. He's dedicated to working with individuals, couples, and families to achieve a higher level of functioning during difficult times. Michael has a Master of Science in Family Therapy and a Bachelor's of Science in Psychology and Human Services from Friends University. He also holds the Approved Clinical Supervisor designation from the American Association of Marriage and Family Therapy and the Kansas Behavioral Sciences Regulatory Board. And Michael, you are the clinical director at the Mental Health Association. Is that correct?
Right.
Great, great, great. So anyway, we appreciate Michael being with us yet again, and I will just turn it over to you, Michael. So
Great.
Thank you all for being here.
Well, good morning, everybody. I want to thank Shelley and for this opportunity to come and spend some time with you this morning. I'll get my screen sharing going up here, and hopefully we can navigate some of these technology pieces here and get some things going. And Shelley or somebody or Matt, could you tell me which screen you're seeing, if you're seeing the big presentation or the one with the notes?
I'm seeing the big one, Michael.
All right, so you just have the one slide on the screen?
Yes, yes.
Okay, great. Well, that's what I want. Well, welcome everybody. This morning, we're going to talk a little bit about the mental health in the workplace, and going to talk about a few things that impact mental health and seeing how it affects employers, frontline staff, and just how we can support people that are struggling with mental illness and things of this nature. As we get started with this, we kind of first have to start with ourselves. We kind of have to look to see, where are we at with this? Are we working to live or living to work? How many hours in a day are you working in a week or a month? When's the last time you took vacation for yourself or to be with your family? In your current role or at work, have you felt anxious, sad, irritated, annoyed, distracted, or confused? And when work in itself, or when home life or stress is getting you down, who comes to mind when you need to talk to someone? These are some questions that we kind of have to check ourselves and ask ourselves from time to time, just to make sure that we are aware of what our needs are and what our limits are, as well as setting an example and role modeling for employees and other peoples in the company, how we are setting the example, how to take care of ourselves, and to valuing that balance that we all long for. We also need to kind of check ourselves, and I ask you guys to kind of take a minute and pause and see what your initial thoughts are when these words come to the screen. Therapy counseling, treatment and recovery, medication, inpatient, suicide, or crisis. Now, when checking ourselves, we really kind of have to ask, what are those initial thoughts that come to mind, or those feelings that come to mind when we see these common terms in the mental health or mental illness field? Because some of those initial thoughts or feelings really speak to if we're experiencing any type of stigma or discrimination when it comes to mental health. There are three predominant areas of stigma: public, self, or institutional. Public stigma involves the negative or discriminatory attitude that others have about mental illness in general. Self-stigma refers to the negative attitudes, including the internal shame that people with mental illness experience and believe about their own condition. Institutional stigma is more systematic, involving policies of government or private organization that intentionally or unintentionally limit those that are experiencing or living with mental illness. So as we kind of check in with ourselves and check our initial thoughts to see if we have any stigma or discriminations or some uncomfortable experiences with mental health, today we're going to look and walk away with a little bit of understanding around the impact of mental health and substance abuse at work, the basic knowledge of some common mental health diagnoses, and what our entire world has revolved around this last year of COVID, and how it's impacted a lot of people, and how it has impacted and increased concerns and vulnerabilities related to mental health. What employers should look for and do, how can employers respond, next steps to embrace wellness at work, and what is expected of me or expected of you. According to the World Health Organization, mental health is defined as a state of well-being in which individuals rely on his or her own abilities to cope with normal stresses in life, can work productively and fruitfully, and is able to make contribution as his or her community. So as you think of that definition, I mean, kind of personalize that. You know, how are you contributing to your community? How are you being able to be fruitful and productive in the day-to-day tasks? And how it relates to work. How are you able to manage with the normal stressors in life of what's on the job and what you bring into the job from home? Statistics show us that 1 in 5 adults have some form of mental health or mental illness, and 1 in 6 children. So the interesting piece to this, out of those other 4 of the adults that aren't affected of them, you know, 1 of 6 of children that they know or care about or in their family is affected by mental illness. Mental illness is more common than cancer, diabetes, or heart disease. Yet we still have limited resources and supports in place to provide these services. Almost half of Americans at some time in their lifetime will experience or meet criteria to qualify for a mental health disorder. In looking at that number, it's pretty astounding, but we see through the research of those individuals that have identified as having mental health disorders, anxiety and mood disorders top the scale, with 42.5 million being diagnosed with anxiety. Anxiety is individuals that experience or respond to certain objects or situations with fear or dread. And a lot of times they are accompanied by physical symptoms, rapid heartbeat, sweating, uncomfortable, sensation, or feeling keyed up, or even physical elements of feeling ill or sick to their stomach. A lot of times these situations, most people can feel a little anxious from time to time, but individuals with this disorder are ones that cannot control the response and it really impedes with their day-to-day functioning. Some of the common labels or diagnoses that fall in this category that some of you might be familiar with is generalized anxiety disorder, obsessive compulsive disorder, panic disorder, post-traumatic stress disorder, and social anxiety disorders. In that category, there are specific things to each one of those labels of the different disorders. However, they all have a common theme. There is a sense or loss of control, and they cannot manage the stress or the symptoms that are causing them to face and deal with the fear or the dread that those situations or objects bring on. Mood disorders are affecting close to 21 million individuals. Now, for most of us, it's pretty common for us to feel down from time to time, or even experience a few mood shifts and swings. Sometimes we even have extreme shifts as we're traveling through icy weather or traveling down Kellogg and dealing with some of those kind of situations. But for an individual that would fall under or meet the criteria of a mood disorder, these are more persistent, nonstop, and severe, that prevent them to be able to attend to their responsibilities at home, at work, in community, or in their relationships. Some of these diagnoses in this category are major depressive disorder, persistent depressive disorder, bipolar disorder, and substance-induced mood disorder. As I kind of mentioned for the anxiety ones, these disorders all have specific, time frames and criteria that fall and meet within certain specific standards of how their treatment or how they're being managed. But the biggest thing to walk away is when you hear one of these or have a staff member or employee who has an anxiety disorder or a mood disorder, is to knowing that something is causing a level of impairment. And it's not just a matter of them having a bad day or not wanting. There is something that's potentially causing their inability to perform certain tasks or manage the situations in their life. A few other categories that aren't necessarily as predominant, but definitely ones that I wanted to bring to your guys' attention today, was another category is psychotic disorders. Now, psychotic disorders, for the most part, are a little bit rarer, but the basic concepts with this one is people struggle to know the difference between what's real and what's not. And they have a sense of not knowing if their reality is the true reality that the rest of us experience. A lot of times people in this category will experience delusional thought, grandiose thoughts, and hallucinations. A lot of individuals will experience with those delusional thoughts some paranoia and things that are outside of their control. Some of these categories are schizophrenia, schizoaffective disorder, brief psychotic disorder, delusional disorder, and substance-induced psychotic disorder. Now, when you hear this category, it seems a little bit more overwhelming, maybe even a little bit scary to think of having somebody that works for you that doesn't know reality from a distorted reality. But a lot of these individuals do really well and can be very functional in their day-to-day living and at work with medication and treatment. And a lot of times these individuals can manage their symptoms and you wouldn't even know it. Another one as we see the aging of America happen, we're seeing increased numbers with dementia. And dementia is one of these areas or mental health as well as medical conditions that affect multiple areas in one person's life. A lot of these individuals suffer with a reduction in their cognitive abilities, and they have some severities where they cannot function day to day and sometimes need, residential care or 24-hour care. Some of those common ones are Alzheimer's, Parkinson's, and Huntington's disease. With this piece of dementia, that it can also bring on or be associated or part of a symptom of another diagnosis. A lot of times we'll see individuals with anxiety disorders who are very worked up or keyed up or having so many rapid thoughts that they cannot rest and are unable to sleep. It's not uncommon where we'll have an individual go a couple days without sleep, And then we'll experience what we call pseudo dementia, where an individual will have some cognitive functioning delays or problems because they haven't been able to rest and their body isn't able to manage and sort through some of those demands that needs to calm or to rest or to kind of cleanse throughout a restful sleep pattern. So dementia is one that, we'll see glimpses of it from time to time, but as we see our numbers in the aging of America, I think we're going to see more of this. The last one that I want to bring to everybody's attention are eating disorders. Now, they aren't near as common, but they are very severe and very risky. Eating disorders aren't just an individual's relationship with food. There are a lot of complex issues that come into this. And in dealing with eating disorders, it usually takes, the expertise of a medical staff, nutritionist, or a dietitian, as well as a psychiatrist or psychologist or a therapist to help navigate some of the demands of this diagnosis of this disorder. Some of the common terms are anorexia, bulimia, binge eating, pica, and rumination. A lot of times eating disorders can happen at any time or along the continuum of a person's lifetime. Sometimes people anticipate or expect them to be younger in adolescents or early adults. However, we see them throughout adulthood as well. Now, as we think about mental health as a continuum, it's far more than just being ill or well. As we move up and down this continuum, there's a lot of things that influence that. Biological factors. What were you given at birth? Your genetic makeup and your brain chemistry. How were you hardwired? And what's there? Life experiences. The nurturing piece of how you were raised and brought up and those experiences. Trauma, abuse, chronic health conditions. Daily stressors, work, home, and other things that we experience within our government and worldwide. These are all factors that impact where we're moving on this continuum of mental health. And our goal is to keep moving forward and to reach full potential and to be able to live satisfying lives. Now, there are times that we'll be on this continuum and there'll be a bump in the road or something will cause us to, stop and pause for a little bit. That could be a health condition, a divorce, a loss in job, struggles with adolescents or children, or anything that could cause us to have to pause and to redirect and focus our goals and reach out for help from time to time. Looking at the numbers, it's pretty astounding to think about, mental health and substance abuse has the ability or has impacted businesses $225.8 billion. Now, in my line of work and in social services, I can't even fathom those kind of numbers. It's just unbelievable to think of that amount of money. Anxiety alone has cost businesses close to $35 billion in loss of production. And then depression is getting close to $44 billion. So if nothing, from the financial standpoint, mental health is a major factor of the overall success and survival rate of a business or an organization. Now, looking at mental health and mental health diagnosis, we have to also look at the mental health diagnosis pieces that are related to substance abuse. According to the World Health Organization, substance abuse is defined as a maladaptive pattern of use indicated by continued use despite knowledge of having a persistent or recurring social, occupational, psychological, or physical problem that is caused or exacerbated by the use. So what does that mean? It means that even though you know that having one too many could cause you to have problems with the legal system if you choose to drive, could cause you to have some interpersonal struggles with the people that you're with or your partner or your family because of your behavior changes that might happen. And even though that there are issues or problems that come up, you continue to choose to engage in that behavior. Numbers show us that 1 in 7, well, there we go. Sorry, I was hitting the wrong key, guys. That 1 in 7 adults struggle with a defined substance abuse disorder.
Janelle, it looks like it's just slides.
Okay,
So you should be able to get in and out without any problem at all, ma'am.
okay, I'm gonna sign into it. Thank you.
Can I ask you to mute, please?
All right. Well, Janelle, welcome. Hope you're able to join us. So in looking at this, I mean, here are some numbers, and this is a little overwhelming. There are a lot for one slide, but I just wanted to give you the opportunity to look at this. A lot of common, substances that we think about is alcohol, marijuana. Here in the Midwest, methamphetamines, comes to a lot of people's minds. But just take a look at these numbers. Now, please take in mind that these numbers come from individuals who have been surveyed and have acknowledged to have a substance issue or in treatment for a substance issue. Knowing that information, it kind of just blows my mind to think about, well, how many people out there have substance issues or problems that are not getting treatment, are not having the opportunity to fill out these surveys or being asked what substances they're using. Obviously, we've seen a lot of shift and change with tobacco, with the new marketing and the use of different vapes and the different stores and things that have popped up. We've seen younger individuals using tobacco products. Alcohol, very common, very socially acceptable. Marijuana, as it shifts and changes in all the other states around Kansas, there's legislation in place to legalize marijuana. We see it increase. The one thing to keep in mind with marijuana use is as states around Kansas are legalizing it, the potency level of marijuana has changed greatly. And the access to different types of marijuana has changed greatly. We've always had different variations to being able to have an edible use or to be able to smoke it or to be able to put it into teas or to drink it. But now we're seeing the greater ease for candies and oils and different things that we call they call them the dabs that are being able to use in the vape pens. So it's the ease and access is increasing. Painkillers are opiates, cocaine, heroin, benzodiazepines. Now benzos, these are the ones that are kind of those, those rescue meds. These are your Xanax. A lot of times we see them being prescribed as emergency medications for situations where a person has gone through a job loss or divorce or a death in their family, and they just can't sleep or cannot rest, and they are given a benzodiazepine to help them calm or to rest. And stimulants, this falls under all the speeds or even the amphetamines kind of fall under this category. So as you take a look at these numbers, it's pretty remarkable how much is out there and what's being used. If we look at, substance use alone, close to 70% of Americans who use illegal drugs are employed. So now keep in mind, again, these are the ones that have, admitted that they have an issue and they completed a survey. Think about the ones that were never asked. And we think about our work staff that, maybe not necessarily need treatment, but have a level of overindulgence. $81 billion lost per year just on substance use. 25 in production, another 25 in healthcare costs. And this is the bigger one, because a lot of times individuals who are struggling with substance use and abuse sometimes have secondary health issues that come up. And this increase their annual health costs for repeated visits, or maybe even emergency visits or medications. We've seen individuals that have struggled with substance use are more vulnerable to the COVID-19 virus and the health concerns that are related to that. Another area of loss is theft. The individuals that have identified that have utilized theft to support their habit shows that 80% of workplace thefts are to support drugs or an alcohol problem. Some of the symptoms that we encounter that we might be able to see is impaired control. Maybe a little too friendly, maybe a little too reactive, can't manage the emotions. Social problems, where we're not necessarily being able to interact as we used to, presenting struggles in meetings or in social events at work. Risky use, where it's overindulging and potentially driving or combining substance. And then we see physical dependence, where the individual struggles to function day to day without some level of that use. Now, one of the things that we've seen an increase with is with this pandemic, and we see a lot of folks working from home, there has been an increase of working and drinking or using substances on the job, because it's a little bit easier, a little bit more convenient to have, a drink or have something when you're working all by yourself and not necessarily being held accountable. Nobody can necessarily see what's in your glass or to smell it, or, a lot of people can hold it together for 30 minutes, an hour, Zoom or video interaction. So we've seen this increase that has happened a great deal. We've even seen a lot of people pushing and encouraging social hour or happy hour through a televideo format. And that's great for social connection, but when we see it's tough and the lines are getting blurred between personal and professional time, we see a lot of those impairments happening. And looking at severity of risk with substance, we have this continuum as well for substance from at risk to severe. And that continuum kind of determines the level of care or intervention that might be encouraged or recommended for that individual. A person at risk could just have to attend a weekend class, or maybe have to go to an 8-hour educational seminar on the use of substance and the risk of using. Mild and moderate can be where they have to go to counseling, or they have to what we call IOP, which is intensive outpatient, where they maybe have to go multiple times in a week and attend groups as well. And then for severe, usually is looking at inpatient treatment. In looking at the mental health and the substance pieces, we find that there are some general areas of direct impact at work. People aren't showing up, absenteeism, calling in sick. When we see increased sick days or repeated or see a pattern, some of this a lot of times can be associated with big deadlines and stressors at work. After they achieve their task or the stressor, there could be an increased time where they need to take away from work. Presenteeism. Now, this one is really risky. I mean, they're physically there, but they're not there. They're not physically or mentally capable of being fully engaged in the work or the task that they're doing. And if we look at manufacturing or manual type positions where we're working with machinery, if they're present but not there attentive, we're going to see increased risk and injuries. Greater distractions, if they're emotionally and mentally are not there, or if they are under the influence, it's very difficult for them to stay focused on what they need to do. Poor communication, they're distant, they're not as responsive. They might not be able to, feel comfortable with people face to face. An individual struggling with anxiety or depression might have a tough time being able to have a sit-down conversation with their manager or their supervisor if they're fearful that their job is in jeopardy. Work environment tension. A lot of times we see this happen because people will take a break or need a leave of absence from work, and that work has to be shared among the other team members, and it creates tension. Or they recognize the person is there, but they're not, attentive to their duties, and there's tension because they're not carrying their weight, and it creates some frustrations among team members. and the individual struggling with mental health issues sometimes have a difficult time perceiving those relationships. And most of all, loss of production and revenue. As we looked at the financial numbers and we looked how mental health and substances can affect an individual across multiple areas of their life, if we see that they're not able to be present and to do their job, then in turn, we're going to see a loss in production or revenue. So let me pause for a second here to see if there's any questions related to substance or mental health or the impact on work before we move into our next section.
I don't have any in the chat, Michael. So please, folks, put your questions in and we can ask those. I actually did have a couple.
Okay.
One of the things, and I don't know that there's an answer to this, but given the fact that there are more and more employees working remotely and the whole issue you talked about, people maybe beginning to abuse substances or use substances, be it alcohol or something else, how would a supervisor even begin to recognize that? And I know the screen up right now, I mean, maybe those are things that they would look at, but any thoughts on that, how supervisors or an employer might, I mean, I guess it would just be based on their productivity, but it's a difficult one.
You're right, because I mean, working remotely, I mean, we have limited interaction and time with them. So areas that we would see this happening is change in their work, their work patterns, their work styles, in their communications. I mean, if there's a shift in their writing, their emails, or their response into memos and exchanges. We would also want to encourage folks to have interactions, to have supervisors to have interaction with their staff, either through a video interaction or by phone more frequently. We'll talk a little bit about this. There is great need when we're working remotely and we have employees feeling that they're in isolation. We need to have frequent contact with them, one way or the other. And sometimes those interactions or those moments, or even those unexpected phone calls, are a way to kind of check to see if a person's really, one, attending to their task and we're at their workstation when they're supposed to be, but also to make sure that if they aren't anticipating a call, then they might be more inclined to be using or to be a little bit more relaxed with it.
Mm-hmm. Mm-hmm. Okay. I did have kind of a comment and a question. It was written really ? 70% of employees use illegal drugs. It does seem like a pretty high number, and I can't go back to the screen, but that does seem like a high number. Has that kind of been your experience since you're in the drug and alcohol treatment field as well?
Well, let me kind of shift that slide a little bit. I mean, you have the numbers right, but it's 70% of those that identify as using drugs or identify as a substance abuse user are employed, not 70% of those employed are drug users. So the reference of that slide is to say that, a lot of people dealing with substance abuse, I mean, they are able to be fully capable and to hold down jobs and to be successful. They have the ability to be able to hold these jobs and to do and meet the expectations of their company or their employers. Now, yes, that is my experience. I mean, we have a lot of individuals who are in treatment, who are holding down jobs. Now, the flip side of that is there's a lot of individuals, especially with what we saw, the decline in the layoff in early last year. We have a lot of folks that have really struggled to get back to work and having a difficult time finding work. And a lot of their substance use is impeding that as well. But there is a large number of folks that are part of the workforce that are engaging or having some struggles with substance use. Now, not necessarily meaning that when they're on the clock, but as a part of their life, either be on the way home or having the nightcap or having the excess on the weekends. Has a tendency to be more common. But what we have noticed is with this remote piece, it allows people to be a little bit more freer to, to start their happy hour earlier in the day while they're still on the clock, or for those who choose to smoke marijuana, to be able to incorporate that because they don't have to take smoke breaks or don't have to be as cautious of that usage because they're not in public eye or they're not around others.
Mhm, mhm. So are you seeing, well, in the data that I've seen is obviously that mental health issues are increasing due to COVID. And I'm now beginning to see, of course, that substance use is increasing as well. Are you seeing that? Just more folks presenting for substance use counseling or treatment?
Yes, and now that's our next section as we get into talk about COVID.
Okay.
So that's a great segue into this next section.
Okay, that sounds great. You
All
can
right.
just move on. Thanks.
So as we think about this last year, I mean, we're almost a full year into this pandemic. And I truly believe that a picture is worth more than 1,000 words. I cannot come up with enough words to explain what this year has been like for me personally or for my team here at MHA. But some of these images are what came to mind. I don't ever want to see that little creative little ball of the virus ever again, because it's been everywhere. As we look at this, our social interactions has changed greatly. We've lost the connection in the interaction of facial expressions. Yes, we can still communicate a lot through our eyes, but one of the things in what I do in the role that I'm in, I really value facial and nonverbal expressions. And now we've entered into this world of everybody wearing masks. And that's really taken and changed that a great deal. And keeping your distance. Everybody has the little things on the floor. We all know this. I'm not questioning or challenging any of this, but it has definitely changed our interaction in our lifestyle. Whereas we would be comfortable to give, an acquaintance a hug or a handshake. Now, we see people giving the elbows or keeping their distance. And there's, for the longest time, this ever longing odor or sense of hand sanitizer everywhere, which is great. I mean, I think we all need to work on our hygiene and be as healthy as we possibly can. But that is definitely one of the things that, as we saw a decline in the availability, we saw different products come out, and there are some products that's been really stinky and really problematic for an office setting. A few of the other ones here is, the one with the store and the empty shelves. That's something that we don't see a lot of times here in the Midwest. Well, outside of a snowstorm when there's no bread or milk, and then, looking at how home has transformed, that in itself speaks a lot. We are not only, having to work from home, and as parents and as adults, we've been able to take on and merge work and home life together and add other job duties of being educators and teachers and encouragements and trying to be able to do arts and crafts and do all these things, as well as hold down their job and keep their production and their responsibilities up, and then managing it all the same. We see some shifts and changes in the numbers, which is positive, and well, hopefully we're on the right track. In looking at where we've been over this last year, the Kreiser Family Foundation did a study. And in this study, they did this through a family pulse survey. And a year ago, from January to June of 2019, the numbers that they were able to survey, only 11% were saying that they were struggling with symptoms of depression and anxiety. Take that a year later, in January of 2021, and that's unbelievable. We're at 41%. So in this time frame, there has been a drastic increase of symptoms and concerns of mental health concerns and areas just because of the pandemic. And I say just because, well, before this pandemic was ever in existence, our country was already in a mental health crisis. We had increasing numbers of mental illness, increasing numbers of substance abuse. suicide rates continue to climb, and we still had limited resources and services available. With COVID, it creates complications. We all have heard and seen the medical side that's associated with it, but individuals with pre-existing mental health or neurological or substance use disorders tend to be more vulnerable and stand a higher risk to face severe health conditions and even a greater risk of death. This is pretty concerning when we think about the overall numbers and potentially that, half of us, 46% of Americans at one time in our life could experience, situations that would qualify for us for a mental health diagnosis. This really speaks to our resiliency level and how we manage it. In looking at one of the other areas of increase is with medications. In traditional American fashion, we take pills, right? Just give me a pill. I'll take a pill and I'll be fine. Well, depression, anxiety, insomnia prescriptions increased 25% just in a matter of a month of last February and March. Anti-anxiety increased 37%. Now, when I came across this information, I had to do a double take. 78% of all of the antidepressant, anxiety, and insomnia prescriptions were brand new prescriptions. So that tells me that for most individuals who have the ability to have support and the resiliency to manage and cope with the day-to-day stressors of life, who are able to do really well on their own, are no longer able to do it. And with the increased fears and worries associated with COVID-19 and this pandemic, a lot of them have experienced greater risk and vulnerability in managing with the stress and the depression and the uncertainty of what's to come. We also have to realize that as more is being added to individuals' lives or their plate, and thinking of your employees or your staff, they're not only having the stress and worry of health concerns. Can they go out? Do they go out? Do they wear masks? Do they not? Is it a matter of life or death and some of the choices that they make? But managing the stress of having to have children at home, have to come up with extra funds now to have internet or to have the ability to teach them from home, and having to deal with increased stress and worry if they're not able to be at home and they're at work, knowing that their third and fourth graders or even younger are at home alone. A lot of these things are just pulling individuals down and just taking a lot of their strength and their resiliency to deal with day-to-day things away from them. In a study, now this is a small study, and this was done from a treatment center called Recovery Village. They surveyed roughly 1,000 people that are in their treatment program, and they identified that throughout the pandemic, now as you can see on this first bullet point, those exceed 100% because a lot of those individuals identified that they had an increase in multiple substances. Out of this group, 88% said they had an increased use or consumption of alcohol, 37% more marijuana, 15% prescriptions, 11% benzos, and 10% stimulants. The reasoning, okay, it makes sense to deal with stress. 39% to relieve boredom. And then 32% to deal or to cope with mental health systems, specifically anxiety and depression. So what we have experienced in our clinic is, as most businesses, we had a decline. As the pandemic, everything shut down, of course, as we incorporated telehealth, that helped us, and we were able to reach some folks and get some people back into care. But what we noticed is we saw a lot of individuals self-medicating with substances. And then when we hit about October, and when we realized that our numbers, we were happy to see our numbers come back and our numbers increasing of intakes and new referrals. But what we were realizing is a lot of those people had had enough and they couldn't do it anymore. They couldn't make do with how they are managing their life, or the way that they were self-medicating with drinking or smoking was now causing secondary problems. And that was not worth it to them. And then they were able to, one, feel comfortable that the virus was in check enough, or trusted, our safety protocol and standards, and the use, became comfortable to use telehealth, and they reached out for services. So as we see this impact and some of this change that has come about, it's everywhere. And as for this group that's here today, just take a minute and just think about how your life is different than it was 18 months ago. And your confidence and your trust in your community and others, as well as your resiliency to handle the stress and frustration of the day-to-day things. And then lastly, how has your hope or confidence been affected because of this virus, and how it's impacted you, your family? And most of all, with this comes loss. People have lost jobs. They have lost, the way of life. They have lost financial means. But the number of deaths because of this and health conditions related to this virus, it's not unreasonable to think or to say that most individuals have experienced or known somebody who has lost somebody because of this. It definitely has taken a vulnerable situation and complicated it even more. And those individuals who did not have any mental health or substance issues are now finding themselves facing those concerns or those issues because of the impact of this virus and this pandemic. Some things to look for, in employees or within your organization. Behaviorally, here's a list. I'm not going to read them. I'll just let you take a look at them. And physically. Now, some of these most common, and even if you've had staff or employees that have had the virus, they report or experience some fatigue, some exhaustion, and it takes some time for that to come back. Some of the things that I've encountered with some of my staff is this piece, or one of the symptoms of just being not necessarily clear-minded, or having kind of this fog, this mental fog. And it takes a little bit more time for them to concentrate or for them to complete tasks. And that's improving as they come out and further away from the illness. But overall, for mental health and substance, we see these things pop up. And if you look at this list, this isn't an uncommon list. Probably, most of us in this webinar here have experienced a headache from time to time, or have experienced some sleeping problems. Or maybe we have a really tough day and there's a lot of going on at home, and we're really struggling to concentrate at work today. These are things that happen, are pretty common for most of us, if not all of us. And what we're looking for is to see a pattern, or to see it show a level of consistency or repeat, and where it's directly impacting, the employee. These are things that you would look for and things that you would provide feedback to that employee. And I'm noticing that you seem tired more days than not. I'm concerned that you're not getting enough rest. Or I've noticed that you're having a lot of, interactions and conflict with your team members, and would like to know what's going on. How can we help you work through some of that? These are things that also are helpful for a write-up, for any disciplinary actions or any type of, improvement plans, to use these behavioral and physical symptoms that you're seeing to kind of help bring it to their attention and to hold some accountability towards them. What to do? So as we look at this and we look at those lists and how it impacts, we look at the numbers financially, as we started this conversation today, well, there's not much of a conversation, this talk, because I'm doing the one talking here. We had to check ourselves, so for companies and organizations, we have to check, do we have mental health stigmas and discriminations? Do we have substance stigma and discrimination? And those are those things that you picked up, or you think back and say, there was a off comment that somebody made. There was a joke that was said. Oh, somebody was out again and somebody in management made this comment. Or, we have some policies and expectations that set people up for failure. So in looking and checking ourselves and being able to review our policies and expectations for employees, as well as for management and leadership, are some helpful steps to get started. We want to create an environment of wellness. We want to encourage that we want employees in our organization to be as healthy as it possibly can. And that's just not mental health. I mean, that's encouraging activity and movement and dietary. A lot of companies have wellness programs or a wellness committee or something where they offer and provide helpful information, to staff, or, provide them, when the farmers market opens up, being able to say, hey, fresh fruits and vegetables here and there, giving some heads up to that. Develop a response plan for mental health emergencies. We'll talk a little bit about that in a few minutes. Provide training. This is key. We don't know what to do if we don't know what there is to do. We don't know how to respond if we don't know what to respond to. So the more training you can provide for your organization or your management or your supervisors, the better off you'll be to kind of recognize and see some of these things, and to make resources available. It's nice to see pamphlets in break rooms or in kind of the areas where staff congregate, being able to have, guides to, the little flyers that say, hey, if you're experiencing, or if your kiddo is struggling. Those are nice because sometimes people just pick them up. They might not do anything about it, or they'll take it and they'll pass it on to somebody else that might need it. Sometimes we see a lot of pamphlets and brochures, being kind of a hassle or a nuisance and kind of just, clogging up an area. Nobody seems to be taking them. But you never know when, that one person in that moment might need it. So having resources available is key. And coming up with a return to work plan. Whenever, a lot of times we'll have people who are out for medical reasons, like a surgery or for a delivery, something of that nature. And those are pretty common and easy to plan for. Okay, it's anticipated. We're 2 weeks out, we're a month out. And in your first month in, we're going to, bring a slow, bring you back in slowly. We also need to have a return to work plan for mental health issues and as well as substance issues when a person has to take a leave or has to go for inpatient treatment. I came across these questions off of the NAMI site. And these are some questions that just make note for yourself of how you would answer this question. These are kind of those to kind of check our beliefs on stigma. I think people with mental illness need to snap out of it, did something wrong to cause it, need our love and support, and are sometimes just faking it. Obviously, the response to this is they need our love and support. We need to be respectful in our language and talking about mental health conditions, challenge any misconceptions when we see or hear them among others, see the person, not the condition, and to offer support to anybody that we think that is going through a tough time. Which of the following is a myth of stigma? it's not really a big problem for people with mental health conditions. Well, it is a big problem. I mean, it affects people's well-being, prevents them from seeking treatment, and it damages their self-esteem. A lot of people with mental health conditions don't feel comfortable talking about them. They feel a lot of judgment and shame, and they don't feel much hope and encouragement that they're going to be able to get through or to not experience these situations anymore. You know, a lot of times people live their lives and isolate and pull away because they don't want anybody to know about it, or they don't want anybody to experience. And a lot of times we'll see some people transition from job to job because as their mental health concerns or their illness changes, they can't hide it anymore. And so they may walk away from the job or leave a job until they feel that they can manage their symptoms to come back and to start anew. Next one. If someone is on your team, is diagnosed with mental illness, you should listen to them and show support. You know, we want to be able to feel informed and to know as much as we can, but also we want to respect a person's privacy. You know, if I know that an employee of mine, you know, just went through a major shoulder surgery, okay, I can have a little bit of knowledge about that. I have some information about it. I can kind of look and see what I can learn about it to know what potential risk or reduction in duties could be, or what the frustrations, you know, not being able to put a shirt on or not being able to raise your head up or different things, little things I can understand. But I might not know what those things could be around major depressive disorder, or, you know, how knowing that a person needs to take a leave for a couple of days because they just can't get motivated to get into work and they just can't get out of bed to make it in. Well, it's not just being lazy or not caring about the job. There is something more to that. And maybe I need to gain as much information that I can. We need to be able to show interest, not as from a curiosity piece or a nosy piece, but interest in the person, not just their condition. We want to encourage them to, you know, to follow their treatment plan or whatever they have in place. And we want to encourage them to take advantage of the resources that are there. We have to be really careful because our words are powerful. We want to try to avoid saying statements like this. And we want to replace these statements with statements more in line with these. Just being able to say, oh man, that sucks, allows the person to feel heard or validated. You know, being able to provide hope and promise of saying people do get better. Or as simple as saying, thanks for sharing, or thanks for talking to me about this today. Because a lot of times we take for granted how difficult it is for a person who's struggling, no matter what it is, in an employment situation, for them to be able to talk and open up about it. With this concept of embracing wellness, it's not just a matter of just one area or one thing. We want to do it across the board. So through this part of this conversation, you know, thinking about how is your company or your organization what do they already have in place that are promoting wellness for your staff? And what are areas that could be a little bit of adjustment, or what are you missing or lacking? You know, we want to have a place where a person feels valued and supported, and provide a positive workplace and show respect for other aspects of that person's life. They're not just here to do this one job. They are more than just this person who clocks in and out. We want to be comfortable. We have to know our own limits. Can I have a conversation about a person's stress, emotions, depression, anxiety, or substance use? If not, and I have my own issues or my own struggles, or I'm working through my own mental health or substance issues, and I can't be where I need to be to talk to this person about it, then maybe I need to make sure that I have them speak to somebody else. Relate and show compassion. Sometimes when we see a decline in production and revenue, we see our businesses struggle. Sometimes we are driven by deadlines and tasks and projects, and sometimes we don't relate to our staff or employees. We only relate to the job at hand. As a company, we need to look and see where our values are. Are they clear? Are they positive? Does the employee know where the values of this company is? You know, it's one thing to have an understanding of the mission statement and the purpose of why this company is here, but it's another thing to have an understanding of what do they truly value. Having a productive atmosphere, you know, that's not just making sure that the workplace has coffee and, you know, and the air freshener smells nice, but a lot of this is having that open door policy, being able to communicate and talk and get things done, and to be encouraging and supportive through all aspects of the day. Providing a livable wage. This one is pretty tough at times when we have some budget restraints and restrictions. Reasonable accommodations. As we are moving more to remote workplaces, you know, sometimes this is difficult to, you know, we have employees working, sitting on their bed, that's their desk, because they live in a one-room apartment and they don't have, you know, the ability to have the furniture that they need. You know, being able to know that as a supervisor, or know that of what their conditions are, might be something to make some adjustments or some accommodations with it. Promoting physical health and activities, having the opportunity to encourage them to be part of a wellness program or to participate in the community health or a gym or activities, or if there are healthy events in the community, maybe encouraging or promoting that or sharing that information with your employees is helpful. Open communication, spoke about that. Employee and management accountability. Now this one's important because as we started this talk today, we have to check ourselves and we have to hold ourselves accountable. If we aren't willing to take time off or be willing to stop and talk to somebody or be willing to take in consideration how much time we're working, we have to set examples and we have to role model that. We want to promote work and life balance, and we want to encourage self-care. Now, self-care, you know, it's kind of this bad thing. Everybody talks about it. Everybody wants it. Everybody thinks it's a good thing. And it is, but we have to be deliberate. We have to set time aside. This is something that we need to encourage people to schedule time to do this. Now, as in my role here as a clinical director, you know, I promote and encourage self-care, but that doesn't mean that you get to take an hour off during your workday to take a nap. You know, that self-care is, you know, being able to incorporate things in your schedule that accommodates so you can do your job and still be able to have that opportunity to meet that need. So then that looks like, you know, maybe having lunch with somebody else, taking a walk at lunchtime, taking your break, you know, throughout your day, to be doing something that's promoting your self-care and your something that you enjoy. That might be spending 5 minutes, you know, catching up on your social media or this or that throughout the day. But self-care also is things that happen outside of work. You know, being able to have a well-balanced meal, time with your family, having a regular sleep schedule, you know, making sure that you're staying within your means and living within your budget. Self-care is not just, you know, these opportunities to meditate or relax or go to yoga class. Those things help and they're important as well. But there's a lot of little things that go in and promote self-care. And sometimes we need to encourage people to make sure they're doing the little things. A couple other, here's a few more ideas. Making health assessments available. Offer free or subsidized screening available and provide direct feedback and referrals. You know, there are Mental Health America on their website. They have free screening. Wichita State University has one of their pages, and I'll share that link with you guys at the end. Has the ability for folks to go on to their website and take a few little survey questions specifically around different types of struggles that a person might be going through. and provide the feedback. It might be one of those things where, as an employer, you bring in a group of people and they offer some debriefing or counseling, around the situation. This is where employee assistant programs come into play a lot, where they can come in and do some coaching or some lunch and learn type settings around specific issues. Making sure that your health insurance that you're offering through your company has a reasonable behavioral health coverage plan and it's not outrageous. And as I mentioned earlier, having materials available. If you have a company website or an intranet where your employees go to a lot to facilitate tasks, their timesheets and different, where they go to get their forms and things that they have to do, it might not be a bad idea to have an ad or something or a flyer connected to that, or a small little video related to mental health that could be at the same location so that they could see it, or they could use a few minutes to take a look at it and see if there's something that's interesting to them. Seminars and workshops. Now this one, I would love to have this one, a quiet place for relaxation. Now some of these aren't even reasonable to have, but depending on your industry, maybe that is just making sure that there is a time and a place if a person needs to step away or to calm down or to manage out of a situation, we can provide that. And sometimes that might be in an office or in a conference room or somewhere that's away from everybody else just for a few minutes. Providing managers and supervisors training to recognize signs and symptoms and encourage them to seek help. This is key, because if I don't know what to look for, I'm not going to see it. And we can think back to our warning signs of behaviors and the physical concerns. And really any shift, if the person's not acting themselves, that should prompt a conversation. If nothing else, saying, how are you doing today? This is what I've noticed. I'm concerned for you. The Shaw Mind Foundation, they are a nonprofit organization that really focuses a lot on mental health in the workplace and trying to keep, employers and employees in the best place that they can be to be successful. They came up with this 5 little steps here. Enforce working hours, limiting out of work hours. Now this is really hard when we're working remotely. You can't necessarily say, clock out and be done. But this is something that we could encourage our staff to do to make sure that they're not working, excessive hours. Avoiding having employees work in isolation. Regular check-ins. This is kind of what I was mentioning earlier, to be able to have meetings or to have conversations or to be able to jump on whatever your video platform is to check with them during the day. Not only to check up to make sure that they're not doing anything that they shouldn't, or to make sure that they truly are working, but to check in just to say, hey, it's been a while since we talked. Just want to check in and see where you're doing, how's things going, is there anything you need today? And sometimes being able to have that connection will reduce the concerns of isolation. Attainable deadlines, spread workloads equally across teams. As we see the impacts of COVID as well as mental health, we notice that some employees aren't able to be as productive. And sometimes there needs to be some adjustments and some deadlines and to be more accommodating to that. And then we also have to realize that sometimes there are some projects and tasks that you cannot delay. You have a deadline to meet something else, which in turn impacts something else. So that's where we have to look at making sure that the workload is spread equally and being able to delegate whenever we have an employee who needs to step away or take some time away. Provide support service and staff members that they've had training in mental health and workplace, and to promote healthy eating and regular exercise. So in looking over these, these are pretty standard, pretty common things that you can incorporate and to put into place. These are things that you can look at your organization as a whole and say, oh, we could add this. That wouldn't be too much of a shift or change, or that wouldn't cost us too much to implement this. There are a lot of different small things that an organization can do to have a big impact. And some of that is just, being available. being present, having the open door policy, being able to, be attentive and responsive, to be engaging with staff. And when we have this remote disconnect, is looking for ways to keep those people engaged. And that might need to be a little extra work, a little extra time on supervisors or managers, and not just be looking at their production and what they're putting out in work, but also checking in to make sure how they are as employees are handling it. Now, we don't want to ever get into a place where we actually have a crisis, but it's important for us to talk about this today. There are crises that happen, and we need to be able to recognize and identify this, and how do we are going to respond to it. As we look at the stages of a mental health crisis, we kind of see the buildup or the anxiety of a person changing and working through something. We'll see a change in their body language. We might see a change in behavior. They might be saying things differently. They might be tapping their feet, fidgeting, pacing. They might be pulling away and isolating from others, not wanting to interact, where they used to go to eat lunch in the break room with everybody. Now they're not. They're going and sitting in their car and eating lunch. Or they're very, resistant or standoffish. These are small things that we need to look to see how this is building. Then we get into this place where a person might become defensive and they have change in their thoughts and behaviors. This might even be a situation where some of that rational thought is not there. They might have some, preconceived notions that they're being treated unfairly, or something's going on with another employee, or that their boss is out to get them. They might even start to act belligerent and challenging authority. When we see that escalate into a physical acting out, where they've lost their control and they're engaging in physical violence, and this is where it gets serious and dangerous for everybody around, because this typically does not go well. After we have the explosion or we have the acting out, we see kind of how that crisis comes back and de-escalates, and we see tension reduction. The person may be able to regain control and start to talk and process about what happened. Now, a lot of times we'll see these small crises build up where we'll have an angry employee, and they might have, some frustrations. They might get defensive. They might not be acting out in physical, violence or aggression, but they might be acting out by, walking out of a room or saying a few choice curse words, or, expressing their true thoughts about a person. And then they're able to calm down or take a break or step away, and then they're able to process and talk about it. During these 4 stages, it's important that we have a plan. So as the anxiousness is building or the stress is building, we want to be alert and aware of what's going on. We want to let them know that we're noticing something about them, that something's not right. And we want to let them know that we care and see if we can help them. Because as this is building, if we catch it early enough, it prevents us to get to that place where there's a blowout or an acting out. And a lot of times when a crisis is happening, the person is feeling that they're in a situation that they cannot control. And by feeling out of control, it pushes more anxiety to the surface. And then when they start to become defensive, we want to give them space and time to talk, because if you are ever in a situation like this, you have something to say, you want people to hear it. And if you are silenced or you are not allowed to do that, it increases the defensiveness even more. But in these situations, we don't want to have an audience. We want to either remove the person to a separate room and to visit with them one-on-one, or to get them to a hallway where there's less people, or to get the people away from them if it's happening in a staff meeting or something where there's a lot of people around, or it's happening in a commons area, the lobby of your place of employment. And maybe it's a piece of transitioning others away from it. Then we want to identify choices and consequences for the person, giving them choices of, come here, let's go down the hall, let's go to my office, let's go to HR, let's have a talk, or, hey, why don't we just go get a drink of water? And even the consequences of, to the point of saying, hey, I really would like to sit down and talk with you. I really don't want to have to send you home right now. Or I really would not want, this to escalate and be problematic for your employment here. As we're giving that person choices and identifying the consequences that can happen, we hope that we're able to still stay within some of that rational thought. If we're not, and we get to the place of acting out and there's a aggression or violence, we need to know who we're going to call. And if your response is 911, then you probably better know how long it takes 911 to get to your place of employment. Because, even though you might have a substation nearby or you see a lot of patrol cars around, it might still take 20, 30 minutes before them to respond or to get to your place of employment. If you don't have security on your on-site, then you might need to develop a team, and there might need to be a response team where it could be members of management that aren't necessarily responding to prevent or to stop a person, but to be able to respond to help support through that situation. And that could be one or two people with the person. That could be another person standing outside to direct, law enforcement into the building. Or that could be another person on that team getting everybody else away from that situation. Tension, wrong button, sorry guys. And then tension reduction. After this is over and all calmed down, we want to be able to sit with them and we want to explore some options and resources. We want to put some things in place that, it very well could be that they're no longer going to be employed there. Or it could be that we need to put some things in place so they can step away and to reach out and talk to somebody or give them a referral for mental health treatment or substance treatment to help them be successful in their role. A lot of times when we're experiencing a crisis, we aren't able to see the options that we have, and it escalates the tension, it escalates the anxiety, and causes a person to become more fearful. Now, this plan, there's a lot of different response plans to crisis or emergencies. So I would just encourage you to make note of these kind of 4 areas and to go back and to look at your company's or organization's response to a crisis, a disaster, or an emergency, and to see how they would fit or match up to a mental health crisis or an emergency where somebody's having a mental health episode where they might be anxious and nervous and having a panic attack on the job, or they are in a place where they're experiencing suicide ideation and they get fixated on something and they can't concentrate or focus and they're noticeably not themselves. Or even to the extent where maybe the person is experiencing a psychotic episode where they have lost sense of their reality and maybe they're super paranoid or they're very nervous or they're experiencing a hallucination at work. A lot of well-intended plans meet the need, but I would encourage you to look at them to see for these situations and these exceptions, because we might need to modify those plans. Now, as I mentioned earlier, training is key. So mental health first aid is one that's out there. This is one that's offered here in Sedgwick County at different times. It really looks to demystify mental illness and give participants the capacity to obtain and process the understanding of the information and be able to make appropriate decisions and to seek care. Here's the link, the website to that. They do offer, individual trainings, but then if you are able to connect with a trainer, it could be that they could come in and provide trainings for your team or for your entire company. There is a cost associated to first aid training, so I don't know what that would be, but it's definitely something to look at. They have a wide variety of different platforms through adults, children's, teens, first responders, those kind of things. And just kind of a glance of what mental health first aid is this acronym of LEE: assess the risk of suicide and harm, listen non-judgmentally, give reassurance and information, encourage appropriate professional help, and encourage self-help and other supportive strategies. Now, this training is really good, and so I would encourage, this would be good for anybody. There's no requirements, no prerequisites or anything. Anybody can participate in this. Another one that's specific to suicide is ASSIST, which stands for Applied Suicide Intervention Skills and Training. It teaches participants to recognize when someone may have thoughts of suicide and work with them to create a plan that will support immediate safety. Now, this one is a little bit more intense. There's a lot of role plays and interactions. It's a 2-day training, and I've gone through this one. And I think the cost was $200 for the training. They are really struggling to meet the need for remote or distant training. So they're in the process of putting together a virtual platform to offer this training as well. But I haven't seen that or was unable to find any place that was offering it. So these are two that are really good, and they are, evidence-based trainings that would help in these situations. Return to work plan, we have to identify where we're at with our stigma and discrimination. We want to make sure that we keep the person's privacy and their health information confidential. As we're putting this plan together, we might want to include the employee, of course, HR, and maybe their health provider or their therapist or psychiatrist if needed or appropriate. And keep in mind that, the manager for this employee, they don't necessarily need to know the details or anything about the leave, but just the plan. And this plan could look like that we're, including when they're returning to work, start date, review date of the plan, duties and tasks that they will pick back up or start doing, what supports and accommodations might be needed to do the job, what tasks and duties need to be avoided if there are medical restrictions, and then including the signatures for all the parties involved. Now, this is really easy to think about and do when you have somebody coming back from like a shoulder or knee surgery, and once their doctor releases them, we know that they're going to still need a little bit of time, to get adjusted or to get back up to speed. But these aren't things that we really think about a lot when it comes to mental health. Or they're, let's say that they're having some difficulties, or you realize that, they're really struggling Mondays and Tuesdays. They're still working through, their hangover or experiencing withdrawals from the weekend. These are things that when we take a leave or we go to treatment, being able to define what is what. Please keep in mind that for that employee who had to take leave, coming back to work is extremely difficult. There could be a lot of judgment, embarrassment, and a lot of anticipated questions that people might have for them. And that might make it extremely difficult for them to want to return to work. So this return to work plan would help provide them some comfort and support in being able to do that. Let's look at some resources and wrap things up here. We talked about employee assistance programs. Hopefully, if you're not part of HR, you have a good relationship with HR and they have a good connection with your broker for your benefits. Here's the website that I was speaking of from Wichita State, and it's through their counseling center. Being able to have partnerships with primary care physicians when you're working with the person on returning back to work. We went through the mental health first aid training and ASSIST. And also keep in mind that, the Wichita area and surrounding area, there's a lot of resources around. We have a lot of, private practices. We have a lot of clinics. We have a lot of resources here to be able to reach out and connect. Even if you don't have an employee assistance program, definitely, don't think that you can't, if you can't afford it through like a national company, there's other ways to go about that as well. Our organization, we have some agreements and some contracts with a few different ones just on employee assistance around mental health. And it's a matter of just reaching out and having a conversation to see if your needs can be met. Some other ones, now as we're remote and people are more inclined to be more digital and have their phones, in hand, there's a lot of apps that are out there. Here's 3 that I'm familiar with: Calm, Headspace, and SuperBetter. Calm really promotes meditation and sleep. There's tons of studies out there to, the impacts of sleep. Headspace is more around just meditation, and SuperBetter builds resiliency and optimism. The link here on this page comes from the Anxiety Depression Association of America, and they have gone through and done an extensive vetting and evaluation of all kinds of different health apps. So I would encourage you to jot that one down and go check them all out, because they've already done the legwork for you to see what's out there. Now, as in my role, and here, I always have to throw in, and I don't necessarily mean to do this at the end and be kind of a downer, but I have to squeeze it in here. We have to look at the suicide numbers for Sedgwick County. This is information that I received from Suicide Prevention and Coalition, as well as KU Med. We've seen a little decline if you look over there from 18 to 19. In comparison, the blue line is Sedgwick County, the orange is Kansas, and the gray is United States. I don't have data, or they don't have data from 17 on yet, but we did have a decline from last year. In 2018, I think we were at 118 suicides for the year, and in 19 we had 94. Decline is great, but it's not enough. I wanted to share this slide with you. This is some of the projections or preliminary data from 2020. The green bar is 18, the orange bar is 19, and the blue bar is 20. If you take into consideration, look at the variations and the increase of 2020. We see that there's only 1 out of 6 months where it's similar or the same. So this in itself will kind of tell us the impact of COVID, the pandemic, and all the shifts and changes of how it's affected work, insecurities, fears, as well as greater vulnerabilities with health and mental health. We see these numbers climbing as well. With suicide, direct responses and resources. Locally, we have CommCare Crisis. We have Stop Suicide ICT. That's their web address. We also have 911, and every ER in town has either somebody on staff on there or have access to somebody to assess or to screen somebody for psychiatric care. Suicide Prevention Hotline, there's their number, as well as the text number. There is one for Veterans Crisis Line, a telephone number, as well as a text. And Trevor Lifeline, a number and text there. What I came across with this one, I added this one because it definitely provides and identifies support to the LGBTQ population, and they identify that it's more for younger adults. But I think it's nice to have a variety of resources for folks to be able to use. We do have a training coming up from Stop Suicide ICT. They are offering a QPR training, which is Question, Persuade, Refer. And I saw them offering it through their Facebook site. It's over the lunch hour on March 5th, and it's free. So for any of you that would be interested, go to Facebook if you have Facebook, or go to their website or reach out to them. And if you have their lunch hour free on the 5th, you could get a nice training on how to address suicide over your lunch hour. We look at this and, here's what we get. If we're able to provide wellness and to provide the support we need for staff, these are the benefits. More resilient, they're able to cope, they have control, they're more confident, they feel good about themselves, they're expressing themselves appropriately, they have good relationships, and all in all, they're able to contribute to their community and their families and to your company. Now, the last question, what is expected of you? We need to be remembered that our employees are the most valuable asset. Without your employees, no work's getting done. And mental health awareness and wellness will help with retention and confidence and keeping staff there. Make yourself available. There will always be something to challenge your availability, a deadline, a phone call, an email, or report, or this or that. But when you have an employee that's in need, make yourself available. And if you're not, then have somebody who can be. know your limits. Don't put yourself in a situation where it's going to go bad. We all have our limits. We all have our weaknesses and vulnerabilities, and we all have, those skeletons in the closet that if we know that we can't address or talk to somebody who has a drug issue, then maybe I need to make sure that I know somebody who can. Don't be afraid to talk. Listen without judgment. Show some compassion. Give them support. Put that plan of action that you have. And most importantly, follow up. Don't just leave them be. Follow up with them and make sure and see how they're doing. And even months out, still follow up and see. All right. Questions? Anything show up in the chat, Shelley?
Yeah, we actually did have some, but we are at our time.
Oh,
So
okay.
we're actually at 11:30. And so what I'm thinking is that I can try to get back with some people. I know there was a question about gender and if there tends to be one gender more than another that's having issues with COVID. And what I have heard, Michael, is that there was an increase in males reporting issues, but I think it's trending now that there's more females. So I don't know if you have a very, very quick response to that, yes or no.
No, I don't have in response to, how COVID is directly affecting one gender over the other. However, I do know that across the board, we have mental health issues affecting, both genders. We seem to have more anxiety and depression with females. However, we've seen more lethal attempts of suicide through men. So it's
Right.
kind of a smattering of all over the place.
Right.
One thing
Right.
that you could do is you can forward those questions to me and I'd be happy to try to address them and get that back to you and you can share with the group. I apologize for going over time.
No, that was great. I will, I know we had one that I'll definitely send to you. And then I just wanted to also remind people too, that as we have been seeing an increase in suicide, we are seeing an increase with the younger, with kids and adolescents. And I've been hearing more about that too. So just keep that in mind, folks, because your employees do have children and they could well be suffering with mental health issues as well. Michael and the Mental Health Association is a great resource for you. I would also remind you that we will be having another training on compassion in the workplace later in the summer, I believe it is. And do remember, compassion is a really critical thing in the workplace. Also, the Kansas Business Group on Health is involved in a project called Path Forward that's focusing on improving access to quality care in the workplace for in the behavioral health space, so substance use and mental health issues. So if you're interested in learning more about that, please let us know. We will be, if you're interested in joining the Kansas Business Group on Health, please let us know. And I appreciate everybody coming. And Michael, once again, great presentation. Thank you so much for your time and your expertise. And I'm sure we'll probably be hearing from you again. And thank you to everybody that attended today. And again, if you have any other questions about this or the Kansas Business Group on Health, please reach out to myself or Matt Tebow, who is our project director. And then we also have our medical director, Dr. Justin Moore. So with that, I am going to go ahead and let everybody go. We're just 3 minutes past. I want to honor our time. But thanks again to everybody. And again, Michael, thank you so much. Stay warm, everybody, and stay safe.
Thank you.
Thank you. Bye.